And sometimes as a doctor, the hardest thing to do is nothing. And we have to wait. We have to give it time. We have to let people get better. And then we can reevaluate and have a clearer picture of what's actually going on with the thyroid once people recover from whatever their stress, their sickness is.
Welcome to the Mindset Mirror Connection podcast, the podcast where we debunk the eat less, move more, shrink more mentality and focus on what really matters, which includes your relationship with your body, food, self-worth, and the behaviors that align with all of those. I'm your host, Christina Hathaway, licensed therapist with specialized training in food and body obsession, certified personal trainer and nutrition coach. At the Mindset Mirror Connection podcast, we believe what you say in your mind, you see in the mirror. So let's have a conversation about that. Before we get into today's amazing episode, I want to make sure you've hit that follow button wherever you're listening to the Mindset Mirror Connection podcast. Also, if you like to listen to this pod on the go, make sure you have those downloads turned on. As always, I love a 5-star rating and review, and I want to thank you for your continued support. Now, let's get into the episode. Welcome back, everybody. I'm so excited to have you here at the Mindset Mirror Connection podcast. Today, I have Dr. Heather Saran, and she is the founder of The Valley. For those of you who don't live here, that's Phoenix and Scottsdale and all the areas. Our only concierge endocrinology practice, which I absolutely love, that is Bright Endocrinology. Her innovative approach to patient care provides personalized solutions without barriers associated with health insurance, which I understand that very well. Her caliber of education combined with her compassionate demeanor has earned her recognition as a top doctor. She's an expert in thyroid disorders, advanced diabetes care, hormone replacement for men and women, weight management, osteoporosis, adrenal and pituitary disorders. She offers in-office fibroscans for the liver, thyroid ultrasound, and thyroid biopsies. So I'm so excited to have you, Dr. Saran, because I don't think I've mentioned this to my listeners, but my mom had thyroid cancer. She had her thyroid removed. And like any mother I grew up in the 80s, early 90s, she didn't tell me. She did not tell us what was happening. She did not tell us that her biopsies came back, that it was positive. She just said, I have some, what did she say? Polyps that they're concerned about, is what she said. I didn't even realize that cancer was that was the actual diagnosis until I text my uncle, her brother, to tell him she's out of surgery. And he goes, oh, just don't worry, it's not hereditary. And I'm like, what is that hereditary? Because she didn't share it with me. So I have so many questions because she doesn't really answer them. She's just one of those moms that's like, it's fine, everything's fine. So this is selfishly for me, but also for our listeners. So thank you for joining me today.
Yes. And that doesn't surprise me. I find a lot of people, I ask them if they have a family history and they say no, or maybe my aunt, something vague. And then they'll come back and they're like, I asked my mom or I asked my sister. It's like, oh yeah, I had that. Grandma had that and Shirley has that. And just no one talks about it.
Why do they do that? I don't understand. And it's like that, like the past generation, like our moms that do that. I don't get it. But no, and then that's so important. So for those of you listening, sit down, a parent, write it down, get one of those voice notes in your phone and get your family history, because that is so true. So I just want to get right into it. What are the most common thyroid conditions that you see in women, and how do they typically present? Maybe the ones that you're seeing the most in your practice?
Yeah, overall, probably globally, the most common endocrine condition that we'll see is hypothyroidism, or an underactive thyroid.
Mm-hmm.
And this is most commonly from an autoimmune condition called Hashimoto's. So again, this runs in families. Most things that are autoimmune affect women more so than men. Men can get it, but yes, usually when I get the family history, it's going back in the women. So we generally kind of assume if you have an underactive thyroid, assuming you haven't had surgery to have the thyroid physically taken out, you haven't had radiation to the head, neck, chest area, some type of cancer, or believe it, back in the day, they used to treat things like acne with radiation.
Oh, that's nice.
Yeah, we see older people and they've had that. That can kind of zap your thyroid. That'll put you at risk for an underactive thyroid and thyroid cancer, a twofer. But usually this autoimmune condition, it's painless, but there's these antibodies that can affect the thyroid. So normally your body's making antibodies and its goal is to keep you healthy, to fight off a bacteria, a virus, But when it's against your thyroid will have some inflammation. Doesn't usually hurt, but just kind of over months, years, the thyroid just kind of slowly starts to stop working. That hormone production slows down and
Hmm.
everything else slows down.
Hmm.
A lot of times people think about weight gain, being tired. Those are definitely very common, but there are things beyond that.
Hmm.
Other things people will notice, I start asking them questions. They're like, yeah, yeah, yeah. So people say they're cold.
Mm.
I'm someone who chronically runs cold, and that's just me. That's
Hmm.
me. But if it's a change from kind of your baseline, people's skin will get dry, even the bowels slow down, they're not moving. So people will get
Pretty
constipated
terrible.
because things just aren't moving through the system. Kind of
Hmm.
similar if someone gets backed up when they're on a pain medicine or something like that.
Hmm.
But it tends to be pretty subtle. So sometimes it's slow. People kind of start to get used to these things. Sometimes it becomes their new.
Right.
That's why it's so important to have a primary care doctor who can kind of screen for some of these things, especially in people who have a family history where they may be prone to developing an underactive thyroid.
Yeah, absolutely. You know what I was thinking as you were talking, like, let's just explain as if nobody understands it, like, what is the job of the thyroid? I think that would be important. And then I will go into my next questions.
All right. Well, I think the best answer is what is not the job of the thyroid?
Oh, love that.
So,
It's like the queen of our body.
more or less, yeah, it has its hand in every organ system.
Hmm.
So it's going to all your organs, all your tissues, and it's in charge of metabolism. So beyond the weight and energy, whether you have too much or too little, it can cause problems. So,
Hmm.
it's going to the brain. So you have too little, people start to brain fog, maybe even some depression. You have too much, people just can't turn their brain off. Insomnia, they can't think, they're having racing thoughts. I'll see people in the office, and it's the first time I met them, and they just won't stop talking to me really fast. And it's like, okay.
Really?
Yeah.
Oh,
Like people
interesting.
get shaky, it affects the nerves if they have too
Hmm.
much. So, and you probably have some other questions about this, but pretty much anything, it could always be the thyroid. There's always the potential that it could be the thyroid because it does
Right.
play a role in all those different systems. So I also think sometimes it gets blamed for things where it may not be its fault because it could be, but it doesn't mean that it is. But I think pretty
Hmm.
much anything you Google, it'll always tell you it could be the thyroid, and
Right.
that's not wrong.
Yeah, that's interesting. I never realized that it was kind of that, like, I think of like the nucleus of the body, other than like the brain, obviously, is just handling everything, but it seems to have such a big effect. So, coming back to symptoms, right? So, we're feeling fatigued. Is hair loss one of them? Because that was something my mom used to tell me all the time. She'd be like, "Oh, your hair is falling out all the time. Like, you need to get your thyroid checked." I don't, is that true?
It can, yeah. Again, it's one of those things where too much or too little can cause problems.
Mm.
So our hairs come from follicles, or these cells kind of always turning over. If there's kind of a stress on the system, then hair kind of becomes one of the least important things. It kind of shuts
Hmm.
down, conserve energy. When it comes to our energy, whether you have too much or too little thyroid hormone, it makes people feel tired.
Hmm. Talk
Sometimes I
about.
get people and they're on medicine and they're tired and they want more, 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 more. And the
Mm.
labs are showing, oh, you're already on the edge of more, or it is too much. It's hard to convince people, but sometimes we even have to back off and they'll come
Mhm.
back saying, oh yeah, I feel better.
Yeah.
Or they're like, I didn't realize it, but I'm not as anxious as I was before. I'm sleeping better than I was. And
Hmm.
so more isn't always better.
Yeah, no, I agree. So you had touched on that. So we have more, if our thyroid is working too hard, what does that look like?
So if the thyroid is overactive, it's the opposite of what I described of things slowing down. Everything is just sped up.
So that's where the anxiety and things come in.
Yes. So, I mean,
Interesting.
that can be seen even in someone whose thyroid doesn't work, or your mom who had it removed if she's just on too much medication.
Hmm.
What's in the thyroid replacement medication is the same hormone. The chemical structure is exactly the same in that medicine as what the thyroid used to make.
Hmm.
So the symptoms, whether it's too much medicine or the thyroid itself, it's just overactive, look the same. So
Mm.
everything's kind of sped up. So we talked about the mind racing, anxiety, shaking. A lot of people complain about their heart racing.
Mm-hmm.
For our older, more mature individuals, sometimes we worry about arrhythmias, skipping beats. That can be dangerous. But even in younger people who have a healthier heart, it'll still go fast. It may not skip a beat, but it's very kind of an unnerving feeling. People just don't feel right in their own skin.
Yes.
Even the bowels are sped up. So now people are defecating more
Mhm.
often.
Yeah. Wow. Yeah. I personally, anytime my heart rate is increased, I just feel so uncomfortable. So I couldn't imagine just like feeling that all the time. Like it's something that I'm so sensitive to. Like I can't drink like cold brew, or even I had a black coffee or a black tea from Delight the other day. And I was like, so I'm so sensitive. I can't imagine feeling that way all the time.
I'm the same way. I
So,
can't handle my heart going fast. I had to cut out caffeine. I just recently started reintroducing it, but I have to take a medicine to slow down my heart.
oh, really? Yeah, I need that too. Even alcohol, I was feeling like because I have an Aura ring, so when I sleep,
Yeah.
my resting heart rate's around like 150 to 154. And it'd go up to like 70, 70, sometimes 80, and I hated it. So I cut that out too.
Yeah, people
Uh,
say they wake up in the middle of the night and they can't sleep. Their heart's going fast with alcohol. You
yes,
know.
that and I have ADHD diagnosis, so I couldn't go on any like stimulants for
Mhm.
that. I did the non-stimulant options. I'm sure the stimulants work better, but I just want to feel like myself and have a little bit more focus, you know? So coming back to this, so when oh, this is great actually. I went to my primary care physician. I said, "Hey, my mom has thyroid cancer or had her thyroid removed for these reasons, and I'd like to get my thyroid tested." Now, at the time, I had a little bit of knowledge. And he tells me, he says, "Well, in your whatever panels they do for my physical, we're going to test your TSH, and that will tell us what we need to know." I later found out there's more to it. So can you describe to someone who maybe is listening, they're feeling some of these symptoms. Obviously, they're going to go and consult with someone like yourself. What is the proper testing to kind of for you to get a bigger, like a clearer picture of what's going on?
So the situation really depends. If you have a family history of thyroid cancer, you can consider getting some more in-depth testing. But the good news for you is that thyroid cancer doesn't usually run in families.
Oh, good. See,
There's
no one told me that either.
there's four different types of thyroid cancer. I won't bore you. There's one that does. It's a very rare.
Hmm.
And so it's you would pretty much know if you had a family history of it. You'd be screened from the time you were a baby for something like that because we can prevent it. Basically, even infants will remove their thyroid to prevent the thyroid cancer from ever coming. In the thyroid replacement medicine, super easy, even for babies. So,
Hmm.
but that being said, a blood test is not going to tell you about your risk for thyroid cancer.
Mm.
So looking at the TSH is just the hormone status. Majority of people with thyroid cancer don't know it, don't have any symptoms. Usually it's found on something else. The doctor feels a lump. These days, people are getting so many routine scans. You get rear-ended, they scan your head, they kind of catch part of your neck. They'll go, "Oh, you have a thyroid nodule." Or you got to get a scan of the blood vessels in the neck, worried about heart disease. You know,
Like, what's in there? I don't even
yeah.
know if I'm filling the right place.
Some are so common and most of them are benign. So sometimes when we find these things, it just creates more dread, more anxiety for people. It makes healthcare more expensive. It does need more testing and workup.
Mhm.
Depending on the study you look at, 95 to 90% of nodules are going to be benign. And even if someone does have thyroid cancer, if it's that typical, more common one, it's not something that usually people die of. You
Mhm.
know, it
Yeah.
will require surgery. You'll probably need a medicine, but it's not something you go and you get chemotherapy and your hair's going to fall out and you're going to be throwing up. Sometimes people will get treatment with a radioactive iodine pill. I don't know if your mom
Mhm.
did that, but you have to be in kind of a
Remember,
modified.
I have no idea what she did.
Yeah.
I figured it out once they were like, you have to remove it. So I have no idea what she did before
They used to
that.
willy-nilly give out radioactive iodine where you had to be in isolation for a few days. And now we know that that doesn't help everyone, so we don't do it as often. So I kind of tell people you're going to need an endocrinologist for the rest of your life, but it becomes more of an inconvenience than anything you need to lose sleep over. Am I going to see my kids, graduate
Right.
or go to their wedding?
You know what drives my clients absolutely crazy is they're eating clean and doing all the workouts, but they don't see the weight budge. Their sleep is all over the place. Their hormones are through the roof and they feel like they're going crazy.
Yeah, it's frustrating because 9 out of 10 times it's something hormone related that no one's looking at. It's perimenopause, menopause. Our biology internally has shifted, but no one's changing the strategy as far as approach.
What if perimenopause support included like therapeutic guidance, nutrition, exercise, and hormonal support all in one place?
Seriously, it would be great if you didn't have to track down like 10 different experts just to feel like yourself again.
That's why I created the Mindset of Menopause and have partnered with Dr. Jordan Trapp to create a comprehensive plan to your hormonal health.
Together, we are making medical insight meet emotional strategy. So your symptoms make sense, your plan actually works, and your power comes back online.
This isn't just support. This is your comeback season.
Click below for more information.
Yeah, that was something that when she said it, I at least had that knowledge. I didn't realize it wasn't hereditary because this whole time, even like I really enjoy the group I go to now. It's called TIA. It's like a women's health group in North Scottsdale. I really enjoy them, but they didn't even inform me that, yes, we can screen and you should, but it's not actually something that's hereditary other than that rare version.
Right. Yeah. If someone has kind of a questionable family history, again, there are these very, very, very rare conditions. There's a few families in the country where that type of thyroid cancer can run in the family, but you usually have to have multiple like first degree relatives with that. So they usually say like three. So, your mom, your sister, I'm an only child, so I would be impossible for me to have for three first degree family relatives with that. So sometimes kind of that questionable area, then we will start to screen family members a little closely. And usually you just need an ultrasound. You just got to get a picture. You got to look at the thyroid.
Yeah.
And the good news about that is ultrasound is the best way. It's generally inexpensive and there's no radiation.
Right. It's super easy to do.
CAT scan or anything like that. But, if we screened everyone, then again, sometimes it's just better that you don't know.
Yeah. No, that's really helpful. Just kind of shifting gears, I study so much about like metabolic disorders and how, diet culture has affected us in regards to not eating enough, not having enough energy. We're seeing things like insulin resistance and a lot of like HPA access issues and this and that and the other thing. I'm curious what your thoughts are on that and what does research show about how we've eaten in these like low calorie deficits? Does that actually affect our metabolism? And if so, how?
So that's a hard question to answer. I mean, we do know that kind of chronic restrictive eating does lower people's metabolic rate. We don't see any data that it's actually like throwing off someone's TSH where it's going to be through the roof and now you need medicine. So there are some mechanisms that we just don't quite understand as to how that happens. I see women, they've been on the same medication dose for years, and then suddenly that dose doesn't work anymore. Something's just kind of shifted, and it can be hard to explain. We know that kind of chronic dieting, stress, things like that definitely can play a role with your thyroid. Usually it's more of a acute situations where something major happens. We'll see people's thyroids be off. They're going through a divorce, their mom dies, something big, and we will see that their numbers are off. The other thing is if people are sick enough to the point they have to be in the hospital, that'll really throw things off.
Interesting.
So
yeah, because
people are in the hospital, they'll check labs, like kind of looking to see what's wrong, and the thyroid will be a little bit off, and people want to try and hang their hat on that. And that's probably not it. It's usually more of the thyroid reacting to the situation itself of whatever the underlying condition is. And sometimes as a doctor, the hardest thing to do is nothing. And we have to wait. We have to give it time. We have to let people get better. And then we can reevaluate and have a clearer picture of what's actually going on with the thyroid once people recover from whatever their stress, their sickness is.
Yeah, that's so interesting. Yeah. It just seems to be such a buzzword. Metabolic disorders and insulin resistance. And there's some truth, at least from what I've read about that, but it definitely is. And they don't necessarily talk about thyroid specifically, but if we're talking about a metabolic disorder, wouldn't we be talking about the thyroid? Or am I wrong?
Someone has a metabolic disorder, we're usually kind of talking about like the constellation of that insulin resistance, an unfavorable cholesterol or a lipid
Mm,
profile. We look at body composition, kind of where the fat is, that belly or that visceral fat has a higher risk for mortality, people dying, heart attacks, strokes. And that's not necessarily the thyroid's fault.
yep. Mm-hmm.
I think metabolism is kind of a catch-all term. It can mean different things. So you just
Mm-hmm.
have to know in which situation are you really applying that. But I will tell you if the thyroid is underactive and it's unrecognized or it's undertreated, someone's not on enough medicine, that it can cause shifts in those parameters.
Interesting.
So we will see that if someone's TSH comes back and it's high, meaning the thyroid's underactive, it's undertreated, that their cholesterol will go up.
Mm,
So if we
that's good to
treat
know.
the thyroid, give it a little bit of time, recheck the cholesterol, we'll see that it will improve. So the thyroid does play a role on those metabolic parameters. It's not necessarily those metabolic parameters affecting the thyroid directly.
Love that. No, that's really helpful. I think a lot of people just associate the two. And that was actually helpful for me because currently I am creating the Mindset of Menopause, which is a program that incorporates mental health around perimenopause and going through the transition, as well as nutritional and nutrition, exercise, lifestyle changes. And a lot of what I've been reading, we talk about metabolic disorders, we talk about insulin resistance, but also there there is some symptoms that as you go through perimenopause that can affect the thyroid, correct?
So your thyroid levels can fluctuate with the hormone shifts, especially when
Mm-hmm.
it comes to estrogen.
Mm,
So if a woman becomes pregnant, she has more estrogen every day, more and more and more estrogen. And that affects something called these binding globulins that kind of hold and collect your thyroid hormone. So
hmm.
the actual active hormone in your system is mostly T4 and a little bit of T3 that's floating around. So what we're measuring in the labs is kind of routinely the TSH, but that's just a signal from the pituitary telling the thyroid what to do. Then the
Hmm.
thyroid has to respond and make T4, T3.
Hmm.
So when someone gets pregnant or they go on a birth control or a hormone replacement, they got more estrogen, that thyroid hormone gets bound up by those increased proteins. And so there's less available, there's less free. So that
Mm,
could definitely make someone hypothyroid if their thyroid can't respond. But like you get pregnant, your pituitary, that's your master hormone gland in the brain, it's automatically going to kick in. It's going to go up and tell your thyroid to make more. So the total goes up, but the actual free part that's active stays relatively the same.
wow.
Now, that's not true if someone's thyroid doesn't work. It was
Hmm.
surgically removed, they had thyroid cancer, a goiter, or just autoimmune Hashimoto's, their thyroid can't keep up to that signal. So I follow a lot of young women, especially during pregnancy. So I always tell my patients, as soon as you find out you're pregnant, let me know because you've got to go up on your thyroid medicine.
Mm,
So we
that's
just
good to know.
know that that's the course. I don't want to wait for things to be off. I'm very proactive in upping that dose because I know it's going to happen. I've seen it happen.
Hmm.
The kind of similar thing in menopause, you have less estrogen. So that dose that if someone's treated with thyroid medicine, that dose that used to work may now be too much. Their
Hmm.
hormone levels go down. They don't have as many of those proteins. And now they've got more free hormone floating around because it's not bound to that protein anymore. So those are kind of some of the metabolic shifts that we'll see when it comes to hormone fluctuations and pregnancy, menopause, things like that.
Is that why we see this was in, where did I see this? I've read so much about menopause, as much whatever I can get my hands on, I'm reading it. But they talked about like having more flares of like Hashimoto symptoms as you're going through perimenopause. Do you see that with your clients, or is it just like case by case scenario?
Yeah, that's hard to say. It's a little more case by case, you know.
Hmm.
The the things that people will usually kind of notice if they're having issues with is usually related to like inflammation. So
Hmm.
people will say they have more joint pains, they just feel a little more achy, they're bloated. Yeah. Swelling, the brain fog, those type of things. And sometimes stress can bring that out. There's a correlation that some people with Hashimoto's, those thyroid antibodies, can be sensitive to certain foods. So gluten's a big one.
Hmm.
So I'll have some people go gluten free and they're like, this diet is hard. I miss my bagels, but they're like, I feel so much better. My joint pain's gone. I can think clearly. I can get up and I can function. And so it's a challenge, but people will feel better even if they don't have a true allergy or it's not celiac disease.
Hmm.
We think some people might be a carrier for something like that, where they don't overtly have it, but they can be symptomatic. And there's not a good like blood test for that. It's really more kind of trial and error.
Hmm.
A lot of
That's
these
real.
autoimmune things tend to run together. You know,
Yeah.
but Hashimoto's, they're more likely to have something else than the average person off the street that's autoimmune, type 1 diabetes, rheumatoid arthritis, things like that.
I love that you talked about the nutrition side of things and the fact this has nothing to do with what we're talking about, but so many people need to make small changes to their nutrition that they don't realize will make them feel so much better. And they're like, but I don't want to give up my bagels. And I'm like, does the bagel make you feel that great? Like as good as you feel all of the time, does the bagel in that short period of time make you feel that good? And usually they're like,
People will
no.
see the symptoms linger for days. You know, I had the
Thank
bagel
you.
for the next 2 to 3 days, they're dragging. So
Hmm.
it's not for everyone. Some people do it. I usually say give it a month, and sometimes it doesn't make a difference in how they feel. And fine. I'm not anti-gluten. I eat gluten myself. But if it makes you feel bad, then why are we doing that?
I agree. What are some other lifestyle changes you recommend for your patients? Just general lifestyle changes regards to nutrition, stress reduction, exercise. What does that look like?
Oh, yeah. I mean, all those things are important. So when it comes to diet, you know, when I'm recommending gluten-free, it may not be for everyone, but it's not even all created the same. I mean, you can be gluten-free and be unhealthy. You
Hmm.
can have
Oh, yeah.
potato chips and be gluten-free and find pasta substitutes. And, some people think of it as just like a catchy, a fad thing or a weight loss diet, and that's not it. But I think people in general, if they're replacing those processed foods with fresh fruits and vegetables, those are generally anti-inflammatory as well. You're not
Hmm.
going to see all the spikes in your sugar levels, and so generally people are more energized.
Hmm.
Exercise is really important, and sometimes people can be intimidated by that. So I usually have to explain to people that I'm not saying you need to go run the Boston Marathon next
Right.
year, but we need to increase activity, whether, it is something that's getting your heart rate up and sustaining that, or just even simple movements throughout the day instead of sitting. So
Hmm.
you can't see it from this angle. I don't know if you saw when I logged on, my desk was going up, my
Oh,
shoulders were
yeah.
green because I have a standing desk and
Same.
I have a treadmill. I'm in my exam room. And so when no one's in here, I wheel it and I stand and I walk while I type or do research or I have a meeting with someone. Sometimes
Hmm.
I'm walking and people see me kind of bobbing up and down because I try and find those little moments where I can just to get those steps in and stay active, even though it's not a big endeavor.
Hmm.
The only frustrating thing is my devices don't always catch it because my arms aren't swinging.
Put it on your ankle
Yeah.
or in your pocket.
Oh, okay, maybe the pocket. Yeah, with my old watch, I could completely take it off and I tie it on my shoe. This one has like
Hmm.
a clasp, and I can't click
Yeah.
good, but
Yeah, no, I was the same way. I have a standing desk and a walking pad as well. And I'm like, it's not counting. And it's just so silly. Like you and I both know, like you're getting the movement in. Like that's
right.
the point. But we've got to see the numbers, you know? We
Yeah.
are goal-driven people. So,
Closed.
yeah, exactly. No, I agree. I love walking too. I think from a mental health perspective, it's one of the best things we can do for our bodies. I oftentimes compare walking to like EMDR because you have this like bilateral stimulation of sound, of sight, and you're moving, you're getting fresh air, you're getting sunshine. Like it's so wonderful. And obviously you're getting in activities. So if anyone's listening and they are that person who is fearful of adding in movement, like just walk. Obviously, if you live in Arizona, pro tip, you got to go at 5 a.m. And this morning at 5 a.m., it was so hot. I'm like, this is hell. But my dogs and I have to take my dog. So it will be hell in my house if I don't take her for her walk in the morning. I love
My
it.
dog is 7 this morning, and my kids went with me, and they were whining the whole time about how hot it was, and they don't have a black furry coat.
Right. I felt like it was like ridiculously hot this morning. I don't know if it was humid or what, but ugh, I hated it. So coming back to kind of we talked about the metabolic disorder and all these flashy terms on social media. What kind of irks you? What is the thing that you see it and you're like, oh, that's so not right? Is there anything that stands out to you?
I mean, one of the things that kind of I've started to embrace, but it used to make me cringe, was the word longevity,
Hmm.
because I feel like it's everywhere, and I'm like, what does that mean? It's not in like a medical textbook. There's not like a defined term, they don't like they do a study and it's like, let's watch people for 3 years and see how many people have heart attacks. It's not like let's measure people longevity. Like what does that
What does
mean?
that mean? I've
You
never
know,
thought of that. I've used that word too. So I'm like, I want you to be independent and lower the being frail and ending up in a nursing home is what I tell people.
well that's exactly it. And so I've actually kind of did some more digging into it. And I think it's really a rebranding of like preventative medicine. And so
Yeah.
I'm now adopting the term just because I think it's so ingrained out there that people have this vague idea what it means, and it might be different to anyone. But I'm even putting together a longevity program. Right now, I see people, and it's usually people who already have a diagnosis. They have type 2 diabetes, and we're trying to fix that. But there's a lot of people who might have pre-diabetes or they have a family history and they're looking to prevent that. So I think that's
Hmm.
what longevity kind of means to me, is to keep people not just living longer, but, healthier, higher quality lives.
Right. Right. No, you're 100% correct because many people live longer, but the last 20 years of their lives are in some sort of care because they're not independent and they're very frail, especially again with like my mom, she has poor posture, she has low muscle mass, like sarcopenia, and I had to get on her. I'm like, you need to do these exercises. She walks, which is great, but she eats like a bird and she lacks protein intake. And I just see her. And now her doctor's like, now we have to do an x-ray on your back because of this kind of hunching that's happened.
Yeah.
And it makes me sad, and my dad has stage 4 cancer. And luckily, he's been someone who is a bit more open to this idea because he makes sure he's getting his protein in before he now this poor man's going through it. He has a hernia, but before that he was doing like even like strength exercises and he's going through chemo and all the things. So he's really like he knows this is stage 4 and we all are aware of what that is. But even then he's like, I'm still going to take care of myself during this time because I still want to be able to walk myself to the bathroom. And it's so important. Tell me about the program. I like to hear more about that.
It's still kind of in the works, but
Mhm.
one of the things we're looking at is looking at some biomarkers. So, some hormone levels, some inflammatory markers that we can use to assess people's risk factors for things like diabetes, heart attacks. I'm still kind of in the early phase of demoing some technology for our
Mm.
wearables, our Aura, our Apple Watches, Fitbits, whatever it is, where it can integrate into one platform, having those fitness markers along with some of those laboratory or biomarkers. And then we can come up with a plan, implement some type of intervention, whether it's diet, exercise, focusing on better sleep, and we can track those. We can easily see them kind of in all of one platform. And then we're also going to be offering some unique cancer screening beyond, you still have to go and get your mammogram and your colonoscopy, but there are some tests that can tell you if you have an early stage cancer that wouldn't be picked up on some of those routine tests or things that aren't so routine.
So important. I've had the genetic testing and I've had I can see the box. It tested for cancer cells in my bloodstream.
Yeah, the one I'm talking about is the Gallery test.
That's exactly what it is.
Yeah. Mm-hmm.
Yeah. I love it. And then the next thing I want to do is the full body MRI, where it kind of just shows you. I want to know everything. The only stupid thing about that is it doesn't, and this might be a dumb statement because I don't know how they work, but it doesn't show anything in regards to like breast health, the full body MRI.
I'm not an expert on that. I mean, every type of imaging has its own drawback to it. So I've seen people who've gotten those. I've heard about the Pronovo scans. And people will like, oh, they found a lump on my thyroid. But MRI isn't very good for telling us much information about the thyroid nodule. The ultrasound, we can much better characterize just by looking at it and kind of predicting, is this a high risk? Is this a low risk nodule? But does it need a biopsy or we actually have to look at those cells? And so a lot of times you just have to put these things together, where the scan will tell you if you have a nodule. But like I said, there's not a blood test. You really just need a biopsy to know is that. Even the Gallery, the cancer test, doesn't pick up thyroid. It's one of the only ones it doesn't pick up. Of course. So it's not perfect for breast cancer, but a lot of head and neck cancers, things like that. And those can be some of the bad ones. Those are the ones you really do want to catch early. Whereas if we're doing an ultrasound of the thyroid, we're not going to be telling you about your spine that you would see on an MRI or anything like that. So we still don't have like one scan of the future where we can, predict everything.
Yeah. Not one drop. What was that lady? The one drop lady that got in trouble?
Oh, yes. No, not Anna Delvey. Wrong.
No. It's not funny. Did you watch both of those big TV movies or whatever they are? Let's look it up. One drop girl is literally what I'm going to put in there. Didn't they both go to the same prison?
Elizabeth Holmes.
Yes. How she talks. No, that would be fantastic, obviously. And I hope that we get there one of these days. But I talk about it all the time to my listeners about the new thing that I'm doing. I'm trying to just get ahead as best I can. However, you said mammogram. I have, like many women, dense breast tissue. So I always have to do the mammogram and the ultrasound. And then now they have you do it's the assessment, the breast health assessment where you do it's a name. I can't think of it off the top of my head, but I will link it in our bio where it tells you like your risk of cancers. And mine was high, really high. It's like the Turek. I don't remember what it was. But it just stinks because you have to do the mammogram and then they want you to do the ultrasound. And I don't know if it's just my insurance or the way my doctor's coding it, but I'm paying out of pocket for this preventative thing. And it's just like, come on, guys, there's got to be a better way,
Don't get me started on what's wrong with the health system, but a lot of times they don't pay for anything preventative. They'll only pay once you have it. So even in the longevity program I'm developing, it costs money. Some people have a hard time swallowing that, but it can save you money in the end, and prevent you from having to take all those medicines, ending up with cancer and treatments and things like that. So that's why I think, what I used to think was cringy, this kind of longevity really is important if you just think about it as being proactive and preventative.
Yep. Absolutely. No, I agree. And the investment part, I agree with you on that too. We don't realize how number one, if you're not getting the right treatment, you're just going from person to person to person, and those copays add up. Then on top of that, if you're not getting the right treatment, you're just getting these like bogus diagnoses. You're going through different medication that's affecting things in your body. It's a mess. And I see it. I'm sure you see it with so many women.
Yeah, and they can't get care in a timely manner. Things are getting delayed or it's just choppy. Nothing is really seamless. So that's kind of why I left a little bit more of the traditional insurance-based realm and went to more of the direct care where we don't have all those limitations that insurance has us strapped down to.
Yeah. You're the second guest literally this week who does concierge care. And I think it's fabulous. She was a psychiatrist. And I think it's so needed. I think it can provide a little bit more of that intimate space where you don't just feel like someone's like, you're in and out like a conveyor belt. I think it's wonderful. And yes, it insurance doesn't cover that. You do pay out of pocket. But again, if you're thinking about, okay, I'm investing in this now, I have this person to take this time with me and they're going to hear me, they're going to listen to me, and I'm more than likely going to get the care that I need instead of, again, the conveyor belt of traditional medicine. That doctor who said, your TSH, he said a lot of stuff to me that I absolutely hated. It was 10 minutes. He was so not helpful. And I went to TIA, and I like them for the stuff that they do. But again, they can only do so much. So obviously, if something was wrong with my thyroid, I'd come to you for sure. Or have you come to me?
Yes.
I love that. So I have a question, and this was just it kind of relates, but what are your thoughts on people in GLP-1s? Like, what is your take on that? I feel like I haven't really talked about that lately. And I was just wondering, like, what are your thoughts on people taking GLP-1s? What are some things that if you have concerns or just what is your perspective on it in general?
I am, in general, a fan of the GLP-1s as a whole, as long as they're used in the appropriate circumstances. So they are so popular. So they are, it's not like kryptonite when it's in the hands of the wrong people. But, anything that has such good success, people are kind of quick to try and make a quick buck off of it.
Right.
So I feel like on every corner in Scottsdale, there's some type of come get your weight loss shot.
Listen to me. My IV place that I do like this subscription has GLP-1 injections. And I get that's like a nurse there, but still I'm like, if I just feel a little sick, this is where I come to like sit in a nice chair and like put some aromatherapy in my nose and an IV in my arm. Like I'm not going to get GLP-1s here, but go ahead.
Someone who can pick the appropriate person for it, who's going to benefit. And it really takes a lot of counseling. People will lose weight, but we worry about that sarcopenia. Anytime you lose weight, you can't just lose all fat. That's not how it works. You're going to lose some muscle.
Right.
So I just saw someone, I think she was in here yesterday. She was in the office. She got an in-body body composition analysis. And someone else used this term, and it's just the easy way to describe it, kind of skinny fat. Her BMI is technically normal, but she has less muscle and she does have extra adipose or fat tissue. And so we talked about before trying to lose any weight of actually trying to put on that muscle and bulk up. Don't do a calorie deficit. You got to build that muscle before you try and lose. Otherwise, we talk about restrictive dieting and metabolism slowing down. That muscle is going to keep your metabolism going. So I said we can revisit this, but you've got to put in some work before we do something like that. And I think there's a lot of misinformation about the GLP-1s as well too. Any side effect gets reported and kind of blown out of proportion. Some of them can be serious. So you always have to screen people and make sure they don't have certain risk factors. One of them is that rare form of thyroid cancer.
I was going to ask.
And so it's part of my template when I talk to people. Do you have that? It's even now on my intake form, so we don't miss it, because people will come in not necessarily looking for weight loss, but then they're like, well, if it's not my thyroid, then why can't I lose weight? And so we end up kind of going down that route. And so you just have to make sure that it's in the appropriate patient candidate. So
yes,
we work on learning those underlying healthy habits. So there's a dietitian that I work with, So not just lose the weight and you still didn't change your bagel addiction.
Back to the bagels. It's always the bagels. I absolutely love this.
Oh, but
What'd you say?
bagels in my house. I have nothing against bagels.
Yes, I know. I do too. I actually found some really high fiber bagels, and they're just Thomas whole wheat bagels. But then I looked at the ingredients and I'm like, oh, that's why they are good for you. Yeah. So what I like to do is just like little like quick fire questions that we call the mindset moments. And they're just little easy things for you. Like, how do you find, and we didn't even touch on this, but this is just questions we ask. Like, how do you like kind of quiet the noise in your head? Like, obviously you're a working mom, you have this awesome, one of the only businesses that is concierge in regards to endocrinology, and you have a family and all the things. Like, how do you kind of quiet all of that noise of being a female entrepreneur and working mom?
Reality TV.
Yay! Yes, tell me more.
Man, once I get those kids to sleep, the backpacks are put away. I can't sit down if things are done. Once I sit, I will not get back up. But I love some Bravo, bring on the load. Yeah, some Love is Blind. I do. I'm not necessarily reading classic tales and Lee Dickens. Give me the Bravo.
Everyone listening is cracking up because I talk about this all the time. I'm on my Love Island kick right now. I don't know if you're watching that. I'm obsessed with it. But yes, I love all things Below Deck, Southern Charm, A Summer House, all of the things. That's awesome. Okay. Can you share one mindset shift that has changed your approach or transformed your approach to health?
I think one of the things, especially recently, I bought my Aura ring when I was Black Friday. I bought it for myself. And it's really changed the way I look at sleep. So I used to just look at the number. Like I kind of know, like when they say you need 8 hours of sleep, some people need more, some people need less. I'm usually like 6.5 hours and I'm good. But sometimes I'm still tired. Sometimes I feel great. So I found that the quality of sleep really makes a difference. So it took me years to figure out like why was my heart rate going so high, and you nailed them as soon as we started talking. Caffeine and alcohol, those were the things. And so now I've got my herbal tea while I watch my reality TV. Last night, I worked with my, dietitian. We were talking about ways to replace alcohol instead of that glass of wine, and she found me a low sugar kombucha. It's got lots of probiotics that kind of fills that need to sip, and it's good for you.
I have so I only use this if I'm going out with friends and I'm choosing not to drink. I have a THC that you can put in like a mocktail, and it's like microdosed, and it just gives you a little bit of that relaxation effect without the like highness. I've never felt out of control because I don't like that. It's called Off Duty, and it's clear, and it just boop boop. You put it in a little mocktail. Highly suggest. Highly recommend. Okay. Last question. What is one book or resource that has greatly influenced your approach to health and wellness?
That's a good one. I'm right now in the middle of a book, which, I have a newsletter that comes out monthly, and I want to start a new feature in it where I have like a quarterly book club. So I'm still kind of vetting the book. But it's by a local physician. She also has kind of a concierge similar program. A lot of it's focused on weight loss, but it's called Beyond Bikini Medicine. And it talks a lot about the disparities in women's health and how even studies, there used to be rules that prevented women from being in studies. So a lot of this data we have is based off studies on men.
Right.
And how women react to stuff maybe a little bit differently. I did learn this in med school when I started 2008. A woman's typical chest pain may be different. It may not be that, grab your chest. It could be shoulder pain.
The widowmaker.
Yeah, and so it may feel different. So sometimes like half the women who are having a heart attack get sent home from the ED because it's just not what we were typically taught in that textbook of this is how people present because it's based off men, not women.
Right. That is something I talk about all the time. And I don't think women realize that, especially around a lot of the diets and why we see men see a lot of more progress from things like keto or even just any change really. And it's just like explaining like I follow Dr. Stacy Sims, like we're not small men. We actually have, we are the ones who produce life and that body is going to be very different than one that does not. And I want to read this book. I already love the title, Beyond Bikini Medicine. Who's the author?
Jyoti Patel? I'll send you the link.
Okay, perfect. I'm like, ooh, I want to read it and maybe try to have her come on. I love that. So awesome. Okay. Anything else that I didn't cover that you're like, I want everyone to know this one thing?
I mean, I think we talked a little about how the thyroid sometimes gets blamed for things that it may or not be it. So I think just letting women know that sometimes they need to advocate for themselves when those tests come back. The thyroid tests come back normal. If it's not the thyroid, then what is it? Sometimes you kind of have to push beyond just kind of those routine screening tests.
Mm-hmm.
Or a lot of it is some of these lifestyle things we were talking about, especially the stress that we're under. I was talking to my husband, I was talking to my friends. It's like, what's one thing if you could like outsource it? What would you change? And I think people were talking about laundry. And I'm like, the mental load, especially people with families, it's not always women, but there's just so much that I have to take on that's not something physical that you can see. So yes, my husband knows how to get the kids dressed and brush their teeth and, pack their lunches, but does he know where their dentist is? Does he know how to call them? Does he know when their last
The name of the teacher?
Right. And there's just so many things that I think take an impact on that. And sometimes mental health will have, physical exacerbations too. And sometimes it's hard to tease apart, what's what. But I would just advocate women to really push, be proactive. Again, the textbooks weren't written based on us. So you may just need to be your best advocate.
Yeah, absolutely. No, I agree with you. A lot of the women that come in here, their unpaid work is twice as much as their paid work sometimes. And even in a partnership. And, we've been taught to take care of others. We've been taught to not say no, like to be needed, to be motherly, but we've not been taught how to do that and take care of ourselves at the same time. So our body, it's at the expense of our bodies. And we oftentimes can see physiological changes in the body because of a psychological issue. And just being a therapist, like even PTSD, you would see people with PTSD who had issues with diabetes, with IBS, with erectile dysfunction. And it was not caused by anything else. They just had this trauma and I shouldn't say not caused, but obviously it had a physiological response to the body to then cause these things to happen with no other underlying issues that would contribute to it normally. So I'm glad that you said that. So awesome. Okay. Well, I let everyone know where they can follow you on the interweb.
Well, if you are thinking about needing to make an appointment with me, if you have any endocrine or you're interested in our longevity program, check out our website. So it's www.brightendocrinology.com. You can also follow me on Instagram. I try and post some health tips, things like that, some fun things. So I'm Dr. Saran on Instagram. And on Facebook, I think I'm some combination of Bright Endocrinology and Heather Saran DO. Yeah.
Yeah. I have a huge group on Facebook and it's just a dying thing and I feel really bad, but I get it. Awesome. Well, everyone, please give Dr. Saran a follow if you are interested. Oh, I do have a question for those who are outside of the Valley, like in other states. Can they still work with you? How does that work?
So I only have a medical license for the state of Arizona. That's a good question because actually just this month, July 1st, we launched our telemedicine program where we'll be seeing people in any part of the state. And this is kind of a test, a little launch to see how it does, but it is a process to get a medical license in other states, but that may be a possibility in 2026. So if someone follows me, we'll let you know when we're ready for that.
I love that. Awesome. Well, thank you guys. Thank you guys for listening. I hope you found this information super helpful. I know I did. I learned so much. If you haven't already, make sure to give us a follow or subscribe if you're watching us on YouTube. We also love 5-star rating and reviews. As I always say, that helps get this information out to more people. And you can check out the show notes for all of the links so that you can follow Dr. Saran and or work with her, which I hope that you do. And I'm going to leave you the same way that I always leave you, reminding you that what you say in your mind, you see in the mirror. Bye.